Personal Story segment tonight. As we have been reporting, millions of Americans are seeing their health care premiums go up big time, sometimes even more than 20%, because some insurance companies are factoring in Obamacare and charging us for services they may have to provide down the road. It looks like things will get much worse. With us now, former New York State Lieutenant Governor Betsy McCaughey, the author of the book, Obama Health Law, What It Says and How to Overturn It. Obviously, that's Ms. McCaughey's point of view. All right, now what I'm interested in is I got a $2,100 hit.
Very common. Many people have gotten that in the mail in the last
But I
week.
investigated the hit. Yeah. And I got back vague things like, well, we have to pay for kids being 26 years old now on their parents' rolls. You can't get pre-existing conditions. You can't deny them. So we got to charge you, Bill, and your family more money. Is that legit?
Yes, let's take a look at this. Is the Obama Health Law, and the first.
This is the whole law, right?
That's
here.
Right.
You got the whole thing.
20 pages of the 2,600 pages go into effect right away, and that's what's costing you money. I'll give you an example. The president is boasting that under this new law, preventive care is free. Well, that's not true. What the law says is that you are required to pay for all preventive services up front. Colonoscopies, mammograms, smoking cessation programs, whether you want them or not. They're prepaid, so the insurance company can't charge you a copay if you choose to get them. But let's face it, the government can't force you to get a colonoscopy, but they are forcing you to pay for one, and it kind of feels the same.
Okay, so if somebody wants to say I want to get a colonoscopy under my health insurance plan, they have to pay for it. The health insurance plan. They have to pay a certain amount of money.
And now
so they're building in that all of the males that they have on the rolls are going to get it.
Well, that's because they were allowed to charge you a copay before,
but they
and
can't
they're not now.
Okay,
right.
So
there's another reason
too.
Okay,
so that's one big reason they're going up. What's another
reason? Another reason is that the Medicaid rolls have gone up a lot. There are 50 million people now on Medicaid.
15?
50.
50.
And Medicaid shortchanges hospitals and doctors. They pay on average 86 cents for every dollar of care. The doctors and hospitals try to make it up by charging privately insured patients more. So the more the Medicaid rolls go up, the more your taxes go up, but also the more your insurance premiums go up. Okay. Even before the recession, the average household
and the insurance companies can't deny the hospitals the money.
Even before the recession, the average household paid $1,800 a year extra in their premium to make up for this. Now there are bigger rate hikes ahead.
When I was listening to the president debate the worthiness of Obamacare and the opposition, I never heard that my insurance was going to go up $2,100 in a year.
Well,
and the small business owners that I know, they never heard it either from the president or the opposition. I was caught by surprise.
Well, the Congressional Budget Office warned members of Congress.
But they didn't call me.
That's right. But they warned members of Congress. I read the report before they voted on this law that it was going to push up your premiums at least 10 to 13%.
The first year?
That's what the Congressional Budget Office said.
But is it the first year or the whole thing?
Well, each year, you're going to see increases, and the big increases are coming in 2014 for two reasons. One is that that's the year you're going to be required to have the one-size-fits-all qualified plan, whether you want it and can pay for it or not. And it's going to include services that you may not want to buy. For example, addiction treatment services for heroin addicts. You're going to have to pay for that.
But I don't want to get too technical here. So you say that for the next 4 years, everybody's health insurance premium is going to go up every year.
Well, and yes, and another reason is that you're going to see the Medicaid rolls continue to go.
I got that. Okay, so that happens. This is like a stealth tax on everybody. And small business, they're not going to hire people because they got to pay all this new money for the health insurance.
Well, but the people who are getting the worst deal of all are baby boomers who are going to be seniors and depending on Medicare, because Medicaid will increase to 82 million people. Medicaid and the public program for children, that's 28% of all non-elderly Americans. To pay for that huge increase in dependence is like welfare reform in reverse. They're taking the money out of Medicare. So according to these projections, which just came out from the government on Thursday, by 2019, an elderly person is going to get $2,000 a year less care.
Because they don't have the money.
Than they would have if this law had not passed.
Right.
Seniors bear the real brunt.
I think the unintended consequences are kicking in big time. I'm sorry, I want to apologize to the audience, so technical, and we don't expect everybody to read 2,600 pages, but this is coming, and it's not great. Ms. McCaughey, thanks very much.
Thank you.